For centuries, humans believed that dangerous disease came from wild animals deep in forests. But some health threats live much closer. They share our buildings. They rest on our rooftops. They gather on our balconies and streets. This creature is gentle in appearance. It does not bite. It does not chase. Yet can silently affect human health. This bird is the pigeon. In this documentary, we explore how pigeons became part of city life and how their close contact with humans can sometimes lead to serious health risk. Pigeons did not invade cities. Cities welcomed pigeons. Tall buildings replaced cliffs. Balconies replace nesting rocks. Food waste replace natural grains. Pigeons need only a few things to survive: shelter, food, and safety. Urban areas provide all of them. Over time, pigeons adapted perfectly to human environment. That is why they are now found in almost every city on earth. Pigeons rarely harm humans directly. The real danger is indirect. Their droppings accumulate on buildings, floors, ventilation areas. When dry, this dropping turns into fine particles. Wind carries them into the air. People unknowingly break them in. The silent exposure is how many pigeons-related infections begin. One serious illness linked to pigeon droppings is histoplasmosis. This disease is caused by a fungus that grows in soil mixes with bird droppings. When disturbed, fungal spores became airborne. Once inhaled, they entered the lungs. Symptoms may include fever, cough, chest pain, and extreme tiredness.
The fever is coming down slowly.
In people with weak immune systems, the infection can become severe. Early diagnosis is critical. Another dangerous infection connected to pigeons is cryptococcosis. This fungal disease often begins in the lungs, but it can spread to the brain. Headaches, confusion, vision problems, people with weakened immunity are at highest risk. The infection develops slowly, making it difficult to detect early.
Recovery is progressing very well.
So the new medication is working?
Yes, absolutely. Continue as prescribed.
Large pigeon population create more than visible mess. They affect air quality. Dust from feathers and droppings mixes with pollution.
Beyond the visible mess, the dried droppings become airborne particulates, impacting air quality, public health.
Pigeon feathers and urban exhaust combine to create a silent threat.
Over time, this can worsen asthma and other breathing problems.
At the lower right lobe, you'll notice the ground glass appearance, typical of
Children and elderly people are especially sensitive.
The breeze feels so good.
What seems harmless can quietly damage respiratory health.
Your vitals look stable. Just take it easy and make sure you wear the mask around others.
Okay, doctor, I understand.
Pigeons often gather near food markets and water sources. Their droppings may contaminate open food and stored grain. Bacteria and fungi can spread this way. Food poisoning outbreaks have been linked to improper hygiene in such areas. Clean handling practices are essential. People living near large pigeon roosting areas face higher exposure. Construction workers cleaning old buildings are at risk. So are sanitation workers and people with weak immune systems. But this is not limited to one group. Pigeon-related healthy issues can affect anyone. This is a city-wide concern.
We're losing him. I need full labs and a cross match right now. Get him stabilized before.
Pigeons are not enemies. They are part of the urban ecosystem. But ignoring hygiene creates health risks. Regular cleaning, safe waste dispersal. Avoid feeding pigeons in public spaces. These simple steps protect both humans and birds. This documentary is not meant to blame. It is meant to inform. Because understanding invisible risk is the first step towards safer cities.